Hello, everyone. Welcome to Osteo Kids Academy. Today we are interviewing Marnie Norfolk. Dr. Marnie Norfolk is based in Melbourne, Australia. She's an advanced paediatric osteopath with over 20 years of experience. Marnie graduated from Vic Uni in 2001 and completed her graduate certificate in neonatal and infant paediatric manual therapy in 2011. Marnie's been heavily involved in paediatric education here in Australia, both with the undergraduate courses and with the SCTF. Marnie runs a busy clinic in Melbourne called Your Body Osteopathy. Welcome, Marnie.
Hello, thank you for that introduction. Hello, everybody.
Firstly, I'd like to hear a bit about your career from starting at university all the way through to now, what you've done and what you're most proud of so far.
Great. Well, yes, I obviously started at Victoria University, which when I started back in goodness me, 1996. The course was in about its third year of operation, and probably at the time RMIT had a really good name because it was very established. But I feel like a lot of people within the osteopathic profession stepped in and really wanted to be part of the process at Vic Uni and ensure we got a really good education. So we had lots of really wonderful people come and teach and lecture us. And it was a really exciting time for me. I really enjoyed studying osteopathy, studying everything. I did quite a lot of work in terms of, we did a master's back in the day, and my master's was on chronic ankle sprains, and I was working in a football club. And after university, I did a lot of work with different sporting clubs and loved working with young people through sport. I always had an interest in pediatrics and young people, and in particular working with babies. And really where that came from was before I got into osteopathy, I went to observe Denise Cornell in practice. She happened to be around the corner from where I grew up, and my sister was her receptionist back in the day. And I had really thought that I was interested in what I thought was manipulative physiotherapy, as in adjustments and physiotherapy. And I guess meeting Denise, I got a bit of an appreciation about what are some of the wonderful things that physiotherapists do and some of the wonderful things that osteopaths did. And I really was interested in a hands-on approach with babies and children. And so it was her that encouraged me to study osteopathy. And yeah, she continues to be a bit of a mentor and a friend to me over the years. She's amazing. She's moved down to the Mornington Peninsula and still treating babies down there. So yeah, I guess for me, it really started, I had a cleft palate growing up. I saw a lot of medical doctors. I guess that gave me an interest in embryology and where things perhaps go right and wrong, and what sorts of things we can look at in practice. I was pretty lucky to set up some pretty interesting work experience, perhaps because of some of those connections. So I was able to go to India between fourth and fifth year and be placed with an obstetrician so that I could watch births and be involved in antenatal care, which I, loved even at that point when I was treating a lot of probably older children and sporting people. I also did a couple of weeks work experience at the Royal Children's Hospital in Melbourne while I was still a student under the top plastic surgeon, who obviously at the time used to be on The Current Affair and so forth, and dealing with quite interesting sort of I guess defects that children, particularly from overseas, have and perhaps come to the wonderful hospital we have here in Melbourne, the Royal Children's Hospital. So
Wow, that would have been amazing.
yeah, just totally incredible, like watching, sort of neurological surgeries, plastic surgeries, oral surgeries, and having those experiences so early in my career. So that'll probably be my first tip to the early career osteopaths, that if you do have connections, sometimes I talk to students who perhaps are swimming teachers and they love working with babies and children and young people. I would suggest that you really consider working in the area and the age group that you want to, and develop your communication skills so that when you then try to apply your osteopathic skills, that it's a lot easier because it's a group of people you can really connect with, and probably perhaps give you also a patient base, because then there's all these people who know that you're an osteopath and are really interested in what your knowledge is around their swimming techniques or whatever area you have contact with.
Mm-hmm. Interesting.
So I guess my story in terms of pediatric teaching and being involved in the universities did come about while I was still at university. I was encouraged to come back and teach. So I came back as an assistant teacher to the university in 2003. And yeah, essentially I have not left teaching the university since 2003, even throughout my maternity leaves. I was able to continue teaching. So when I had my first baby, she became the model on the pediatric course I helped to set up and run in 2011. And luckily my other daughter was born just after our exam period. And so I had a couple of months off and was able to go back the next year. So I do feel really proud of the opportunities that I've been able to have through the university's teaching, and I guess through my passion for working with students and working with osteopaths. I've formalised my teaching qualifications back in 2008 at Victoria University. And when I was doing that first postgraduate qualification after my master's, I was actually working in paediatric clinics within both universities in Melbourne. So we had a paediatric clinic running at RMIT where I worked for quite a long time to build my skills. So that would be another tip for early career osteopaths or osteopaths wanting to transition to working with more babies and children. I would really encourage you to consider having a mentor that you perhaps refer the trickier clients to, or being in a wonderful forum like Anna has set up where we can all support each other to have more babies have access to osteopaths, but also to keep developing our skills as osteopaths. Because of course, when we begin compared to when we've been treating babies for 20 years, there's obviously some tips and things that you learn along the way. So that's part of why I'm here today, because I love that there's a great forum in Australia to support all osteopaths if they are interested in working with babies and children. So thanks for setting it up, Anna.
No worries. One of the things that people who are watching from overseas might not be aware of is that for a lot of Australian osteopaths, Marnie is the only exposure they've had to a pediatric sort of experience or training at university. Would that be fair to say? For many years, you've been very much involved with them.
Yes, I very luckily during COVID, so probably I'm trying to think of the year, maybe 2021, I helped revamp the lecture and video series for treating pregnant women, treating babies, treating toddlers and adolescents through Victoria University. So quite a lot of their lectures are recorded lectures of me, and there's quite a lot of videos of me taking case histories, examining and treating these age groups. And certainly if at Victoria University, if perhaps a pregnant lady gets booked into the student clinic, they'll quite often send that video to the student before they treat the patient in practice. At RMIT, I haven't been involved in teaching as much in terms of the pediatric side of things, probably since having my children. I'm working there as a clinician, and I'm actually on the aged care placement, which I'm also really enjoying. So I guess people get to know me and ask me a little bit through that, but I'm doing a bit less formal teaching there than perhaps I did before the kids, where I did teach at both universities for a long time.
Wowzers. Thank you for that. Because before we started recording, we were just talking about the enormous amount of work required to create resources and build courses. And Marnie's put a huge amount of work into building up the skill set of our undergraduate students. Plenty of it probably out of hours and unpaid, I'd imagine. Would
Yes.
that be a fair thing to say? Yeah. Oh, yeah. Um, so, yeah, the other
I
thing we
think
were
that's,
talking. Yeah,
yeah, so I think that's really exciting to think about. I guess on the back of doing in 2008 the graduate certificate in teaching, that helped me to be involved at Victoria University, where in 2011 and in 2012, the most recent postgraduate osteopathic course or manual therapy course was available. I was really lucky to be, I guess, pre-kids and working at both universities about a day a week at that point, as well as practice. And understanding that somebody else, Brian Nichols, did a huge amount of work in terms of writing the backstory to get the course to run. So there's a huge amount of linguistic and academic writing to get any course approved. And of course, we also have to recruit teachers, see if they will do what we need them to do in line with the university guidelines and pay schedules, which are also fairly low. So yes, it is difficult to set up formal courses, but certainly been very rewarding to have been a part of a number of people who helped set up and run that course.
Yeah, it was great, and definitely going through it, I was well aware of the huge amount of work. I remember doing some of Janine Klein's lectures and having to just stop, rewind, listen, think about it, listen to a bit more. Like they were just so full of information. They were amazing.
Yes.
Um, I was actually a table tutor for a few years at Vic Uni, teaching the fourth year indirect course, just helping out with it. So I was actually on campus every week through that year as well. That the grad cert was running, and it was a fantastic time actually. And I wish we'd been more aware of just what a short period of time it was going to be available for. I think when these things start, you think, oh, great, I'll do my grad cert and then I'll doodle along and do the diploma and move on to the masters. And, you know, it's such a small profession. And I guess, yeah, we're lucky that RMIT and the other courses, I suppose, are all still running, really. Sometimes you have to take a step back and just be grateful for what we have had. But certainly that in the lead up to talking to you today, one of the questions that people have is, you know, what are the options for osteopaths who finish uni and do a year or two or, you know, some time treating and then really feel like peds is their home. What options do they have these days for moving into a pediatric, you know, career?
Yeah, well, COVID has given us some really good options in terms of online courses and therefore kind of opened the world, if you like, to some of the courses that we may not have been able to do from our home and our lounge room in the past. Osteopathy Australia definitely do try to support all areas of practice, and I've been very grateful for their support over many years. And they do have some really good quality courses that are part of your membership that you can do. And essentially they come from the background of sort of the maternal child health nurse midwife model, where we're learning about what is normal development, which is, I guess, very different to treating adults. Like obviously once we're treating people that are in a primary school age, 0 to 6 is the major time of neurological development in our life. So in terms of normality and growth and motor milestones, there's a huge amount that happens in those 0 to 6 age category that you don't need to know a huge amount to treat adults, but certainly the more younger people that you treat, the more important you start to understand, knowing and understanding that area is. So I think a little bit, like I said, I would probably start with trying to connect with young people in any connection you might have outside of osteopathy. Then I would have a good look at the Osteopathy Australia resources, because it's another good reason to be a member and to get more out of your membership, because there are some free online courses. I would also encourage you to be in some free forums. So I think these sorts of, the Osteo Kids Academy is fantastic. The Pediatric Osteopathy Facebook group that many people are also in, and definitely that's how I found Anna and this new group. I would highly recommend. And then I would also look for other types of postgraduate courses that perhaps are online, and therefore you can test it out and taste it a little bit where it's a bit less cost involved. Often the online courses are slightly cheaper because, of course, you can record something and replay it, whereas when you set up a course like I have many times for the SCTF, booking a venue, booking speakers, having the odd person or couple of people pull out and then need a refund, it certainly can be quite challenging to run face-to-face courses and have really great content and have enough tutors, and then also a low cost, which a lot of newer graduates would really like. So some of the courses that you can do online, places like the Tongue Tie Institute have an online course that's very well done, well recorded. Caroline Stone has some really lovely pediatric programs where there's a lot of academic information. And I know there are some other sources too, the Royal Children's Hospital and some of those large organisations also have resources that we can access.
Yeah, there's lots of different options. And when I think about how people achieve advanced practice, I suppose there's a number of ways to attain that through becoming an IBCLC, or as we were saying, my colleague Betsy did her diploma of child health at Sydney Uni. What other ways are people getting their advanced practice? Is it from the postgrad peds that we did and then just showing recency of practice and experience, or are there any other ways that people are doing it?
Yeah, it's a great question. So I guess firstly, there's two ways that you can qualify for advanced practice, and one would be considered the tertiary pathway. And the tertiary pathway, of course, does mean that you need some form of formal education. So at the current state in Australia, yes, that would be other types of programs like you mentioned. For young people who enjoy travelling, there is the option to go to London and do their paediatric program. And I know a number of osteopaths that are young and have the ability to travel have found that to be an amazing program. So I would definitely give that a plug. Obviously, in the UK, there is a little bit more access to large paediatric clinics where you have an experienced practitioner treating, and people doing the program come along and treat and observe so that they get a lot of hands-on practice plus the formal education. There is some interesting programs running with women's health and things too through Italy, Germany. So certainly Europe is a great place for education. So I would definitely say that pathway as well. But currently in Australia, there isn't technically a course available for osteopaths unless we step outside and look at something like you mentioned, like being an a lactation consultant. No, I'll say the letters wrong. And so I think it's important to also recognise that there is another pathway in Australia that Osteopathy Australia has set up, and that's called the vocational pathway. So essentially that's looking at people who have been interested for a long time, have definitely done a lot of postgrad paediatric programs, have been involved in mentorship, can prove that they're reading articles and staying up to date. And so there are ways without a tertiary education that people can get recognised in Australia too.
Gotcha. And the vocational pathway, is that quite complex as far as having how being able to prove that you have that that pediatric knowledge? Is that quite an involved process for the vocational pathway? Do you have to do case studies or anything like that?
Both pathways through Osteopathy Australia are really well set up, and they've obviously, I'm sure, gone outside of Osteopathy Australia to have a really good pathway for this recognition. And there are certainly people who assess your application and will ask for further information if there is not enough information. So probably the best place to get that information about advanced process and the practice and the difference between them would be Osteopathy Australia and through the website. But yes, there certainly are cases. You can get other practitioners that you work with also to be your referee. So whether you're working with lactation consultants, dentists, health nurses, pediatricians. So there are ways to also show that you understand multidisciplinary healthcare in Australia, specifically related to pediatrics. That will also add to that vocational study as well. But yes, there is quite a particular pathway that you do have to follow, but it does mean that there is a great option for people, particularly who perhaps don't want to do a tertiary course, but would like to do shorter courses to build into a pediatric pathway of practice.
That's great. That's great. Again, a huge amount of time and effort and thought obviously has gone into this process. And it's a good reminder that the OCC is there in the UK for those of us that would like to go and check that out. I think that would be pretty fantastic, wouldn't it, to go and hang out with those guys. There's actually a few OCC people in the academy, so I'll have to get onto them for an interview as well at some point.
I think so. And I think it's a fun way to do it, you know, for our newer career osteos that quite possibly would enjoy some travel and fun, to be able to maybe kill two birds with one stone, you know, to do some fun and be young, but perhaps also tied in with sort of advancing their career would be really lovely. For those of us nicely, I guess, who are a little older, I also find that a lot of osteopaths get into treating children, perhaps when they get pregnant and when they have babies. It's a really common time for them to go, oh, I never thought I was interested in treating babies. And I get a huge number of referrals from other osteopaths, from perhaps students I've treated over the years, who do come back with their children, and whether it's just about an osteopathic consult for their child, but often I think they are kind of checking out some of the things that I do and say so that they might be able to expand their practice. So I think that's a really common time for both male and female osteos that then consider what pediatrics might mean once they have a family of their own. And I do think nicely, once you've got a family of your own, a lot of people perhaps buy a house and therefore become stable in one area.
Mm-hmm.
And so if that area is in Australia and there isn't a postgrad course available at the current time, they might look for some other interesting ways to get involved in pediatrics. So one of the other things that I've been really proud of over the last couple of years, I've always had a really strong interest in research. I felt like even when I was at university back in 2001, there really wasn't any research. And so we were sort of allowed to say, well, all the patients like it, so it must work. And it's been around for a long time, so let's keep doing it. And in our current climate, obviously, I think that there's a lot more research, and I think that research can actually inform our practice in a really positive way. But I also think that having practitioners like perhaps Anna and myself with a lot of clinical experience, we can actually then drive research. Because obviously if we're seeing something and we formalise what we're seeing, then that can add to the body of evidence and have a beautiful impact on practice in the future and growing the research base for osteopaths. So recently I was also involved in the QT study. So it was, I'm going to be crying, unsettled, or it was a colic study that was run through the UK, supported by Osteopathy Australia. And there are about 6 osteopaths in Australia who also did the training, and we were able to link in with some of these amazing researchers through the UK, and get more cases to try to have a study of a bigger power. So you can write a case study, and you can also look out for opportunities to, you know, I guess, be involved an hour or 2 a week in the evening and still contribute to the body of research without perhaps going and doing a PhD or something bigger, if that's not your dream.
God forbid. My husband did a PhD, so I know what it's like. No thanks.
Yeah, it's big, isn't it? I haven't done mine, but I do know it's big.
Yeah, but research is fascinating, isn't it? And definitely I feel like I've got the headspace these days to just do a bit more of it, you know? I feel like, yeah, at this time in my career, with so many thousands of hours of practice behind me, it does feel like I can spread my wings a little bit in some different areas and do a bit more research and, yeah, building the academy and just trying out a few different things. So yeah, now that I almost feel like now I've got actually enough knowledge to actually have something to say, which is nice.
Yeah, which is amazing, isn't it? And I think obviously you've been working and building your practice and having younger osteopaths who obviously want to learn from you. And I certainly also, there's 9 of us now at my little practice, and I feel like over the next year or two, using some of the resources and skills within the practice to develop definitely treating all age groups, but also supporting those osteopaths who also are interested in pediatrics is a really fun thing to be able to do. So I don't know if you've been getting a few extra members this week in the Osteo Kids Academy, because literally when I've had osteopaths that have come and seen me this week with their babies, I've been saying, I'm getting interviewed on Friday, and did you realise that there's this wonderful new group that we can all contribute and collaborate with within Australia to support osteopathy and pediatrics? And the feedback's really been lovely.
Oh, great. I was looking at the membership actually, just as an aside, and we have osteopaths from all over Europe, India, um, Australia and New Zealand. It's really surprising actually how widely spread osteopaths are. We don't have many from the US yet, and I wonder if that's because they're, more like pediatricians than manual therapists. But it's a really interesting group with quite a broad range of training and experience in there. So it's very, very, very fun. Um, my next question for you is about the QT study, actually. My favorite group of babies to treat are the really cranky ones, the ones that cry a lot and are really unsettled and miserable. And when their parents bring them in, they look at me like, I hate you already. And they just hate life, basically. They're just miserable little things. And I really love treating them. I feel like osteopathy can provide so much to those families that are just in the absolute thick of it and having a horrible time. How do you treat those babies? Was the cutie study sort of around those sorts of presentations, or was it similar in any way?
I might need to just pause briefly if we can.
Sure. We're back.
Great.
Right.
Perfect. So sorry, just remind me your question.
My question is, it sort of referred back to the cutie study, but I'm really interested in how you approach really unsettled babies, partly because they are such a challenge for early career pediatric osteopaths, and they can be quite scary to treat. And I'm really curious and interested in how you approach them, and if you've got any favorite techniques that you use for them.
It's a great question. And even though it was wonderful to be part of the study, the cutie study did run during COVID. So particularly working in Victoria, where we had so many restrictions, did make recruiting patients difficult. In terms of to be a part of the study, most people understand that the definition of colic is a baby that cries for 3 hours a day for 3 days of a week over 3 weeks. And babies that to be diagnosed as having colic are typically under 12 weeks of age. So when we can be the most helpful can sometimes be a difficult age to recruit, especially if we've got a respiratory condition with mask use happening. And obviously the treatment was nothing. So the babies could be treated for nothing. And the study was set up with a placebo or a non-treatment treatment or the treatment. So there was a lot of variables in the study internationally that were set up very, very well, but particularly there was a few osteopaths on the study who were in Melbourne. And I think most people watching probably understand that there were more restrictions in metropolitan Melbourne during the COVID years than other places. But in terms of generally treating unsettled babies, it is one of my favourite things to do. And typically when I talk to early career osteopaths, probably something that I suggest they steer away from until they're feeling a little bit more comfortable. So I talk to early career osteopaths about understanding normal development, understanding some pregnancy, normal pregnancy and complicated pregnancy and labour stories and histories, also normal development of babies, and perhaps starting to treat babies that have things like positional talipes or a stiff neck or something that's not digestive and quite as tricky. But certainly this is a great place to tell people about that experience so that they can grow into that area, because I do think both reflux and colic are very common presentations to osteopath, and also young babies get it, they're quite distressed. The medical care doesn't always help that much. Reflux medications are out of favour a little bit at the moment and being prescribed less. And so looking at what we can do gently to a baby with manual therapy with digestive distress has been a wonderful area of practice for me. So typically, in short, when I meet one of these really unsettled babies, I say to the parents, your baby is already crying. Your baby is likely to cry the whole time that we're together. So what we need to work out is, what is the issue and can I help? And as an osteopath, what I can help really well with is mechanical strain. So if your baby had a difficult birth, if your baby was engaged very long term during the pregnancy, so a first time mother, often the baby will be engaged from 36 weeks. And if the baby doesn't come until 42 weeks, they've definitely had reduced fetal movement opportunities due to being engaged in the pelvis, which is commonly head down. We know that the vagus nerve is very important, comes out the jugular foramen. So areas like head and neck drainage are a very common area we treat on all babies, but definitely can have an impact on the way the vagus nerve supports the viscera, particularly the digestive system. And obviously with colic, we're looking a little bit more at the other end. So with colic, we're typically interested in the sacrum, because of the nerves coming out to then supply the bowels. And we think that colic is perhaps a spasming of the bowel that's happening a little bit out of order, and perhaps that food is not flowing through from top to bottom in order. And so when the bowel spasms and there's nothing inside the bowel, it hurts and the baby cries. So in terms of treating those babies, we also understand the anatomy of the uterus and the circumferential rings of muscle within the uterus. So a head down baby is having a lot of contractural pressure during the birthing process on the sacrum. Of course, babies that are born breech, or babies that perhaps have early diagnosis of DDH, so developmental dysplasia of the hip, and are wearing a brace, have restriction of sacral movement and sacral flow. So certainly for very small babies under 3 months, commonly we're helping to manage the discomfort of colic. And between 3 to 6 months, the digestive complaints are a little bit more commonly coming from a reflux point of view because of the development of the digestive tract. So in terms of the treatments I like to do, when the baby's crying a lot, I sort of talk to the parents about that and whether we can find something that we think is osteopathic and mechanical to treat. And I suggest that they come along for 3 weekly sessions where we definitely track whether the baby is better, worse, or the same after our treatment, but not necessarily judge it on just one treatment. And to say kindly, the baby is crying anyway. So as long as we are both comfortable with the level of distress of the baby during the treatment, if we do it 3 times and we make no difference, we consider that perhaps there are some other things that are more important than the mechanical strains for the baby's distress and for the baby's digestion. But of course, we're always working in with health nurses, lactation consultants, GPs, pediatricians, and ensuring that, you know, that we're talking about a baby who is essentially well but uncomfortable.
Yep. Yep. Thanks. That was amazing. That was so well put. Thank you so much. Um, what about breech babies? What do you find in breech babies? Are there any sort of generalizations you can make about what you find osteopathically?
Breech babies are very interesting. I know that I was a footling breech, so I know that when I was born, I pushed out a foot and then they pulled me out. And having a cleft palate, they knew that there was something wrong. So it's not uncommon for a breech baby for medically them to consider that there are things wrong. So not necessarily a cleft palate or any sort of problem, but the medical profession are less happy about delivering breech babies. There aren't many public hospitals or private hospitals in Melbourne that encourage women to have a breech birth because there are some risks. But we do know that sometimes things just happen and the baby comes out okay and they were breech. Or we know that some women would really prefer a vaginal birth, and so they work hard to find an obstetrician with enough experience to help them to deliver a breech birth. So it's worth telling our osteopaths that the vast majority of babies are hopefully born vaginally and head first, and that many breech babies are delivered by cesarean due to the extra risks, and often both the medical profession and the parents would prefer a safer option and choose a cesarean section. So the differences, firstly, with the breech birth is a little bit whether there was a labour or not, or whether there was a vaginal birth or a cesarean. But it definitely tends to mean that there's a lot more pressure around the sacrum and the hips. There's a lot more chance for a developmental dysplasia of the hip to occur, any sort of dislocations or issues with the hips. Twin births is another good example of that. And so very commonly, breech babies are encouraged to have an ultrasound within 6 to 12 weeks of birth to ensure that their hip development is adequate. And it's really good for osteopaths to know and support that so that we do pick up any early hip pathologies if they're there. But in terms of treating babies that have had a breech birth, the common finding for me is that instead of all of the pressure of the birth feeling like a lot of it comes from the head and neck and down, that it comes from the bottom, the pelvis and up. So commonly when I meet a baby, if I was treating an adult, I would sort of look at them standing and treat from the feet up. And when I treat a baby, I almost always treat from the feet up as an introduction so that the baby gets used to you. But what I really want to do is treat that head and neck, whereas with a breech baby, I'm very interested in the umbilicus, the length of the cord, and the sacrum and the pelvis. And the legs, depending on whether it was a frank breech or a footling breech.
Gotcha.
And talipes comes more commonly too with the breech birth. So the feet and lower limbs can be more important.
Yep. Yep. Yeah. They certainly feel very different, don't they?
Mm. Yep.
It never ceases to amaze me what a wide variety of ways babies can get jammed into what positions they can get stuck in. Transverse, breech, posterior. There's just, yeah, there's common patterns I see of intrauterine patterns, but certainly each baby has their own little version of it, don't they? Where they're just that little bit.
Absolutely. And transverse birth position is often one that medically is considered less safe and often goes better with some medical intervention. So that's worth people knowing. Whereas when you're head down and your baby's in the right position of left occiput anterior, commonly vaginal births will go off with less hiccups, which is a great thing.
Absolutely. Although we still find neck rotation preferences, don't we?
Yes, yes, we do. And I assume that talking about some of these clinical cases and the things that we see for the people watching is probably the most interesting part of our chat. Certainly some of my pediatric favourite things to treat would be things like neck strains, which is probably the absolute most common thing that babies come in for. And yeah, literally that's what the baby before coming on this interview, certainly we were looking at hip development, we were looking at neck strain, and we were looking at a lip tie. So those are things that I do see a lot of. So looking at head shape issues, in towing in toddlers is really fun. I also love treating babies that have had other sorts of pathologies, and perhaps that's my own history with the cleft palate. I love treating babies that have had to have heart surgery or other types of pathologies and just supporting them to feel their best. So that's really lovely too.
That is fantastic. Do you do much with the National Disability Insurance Scheme here in Australia?
Yeah, it's an interesting one. I had a baby that I saw yesterday that had some uh, bleeds on the brain, and also a cardiac issue. So I met the baby very young, properly medically managed, and working alongside a physio to ensure motor development is developing really well. Baby is now 18 months and yeah, is doing very, very well. So I'm sure the next steps will be to meet a pediatrician again and have an MRI done around 2, which is when an MRI is accurate in babies and kids. But from everything that we can see so far, both the physio and myself are really pleased with how this baby's developing, and the heart surgery was a great success.
Wonderful. Do you work with physios often?
It's a great question. I think it depends a little bit. I think often when there is some funding in place like the NDIS, I probably do it a lot more because families can afford both because they've got some support. I very often find that families will see both. Sometimes they pick one or the other of us, depending on the presentation and how their baby is responding. But I do think it's really useful. And I feel like physios are particularly helpful in the NDIS space. And when there are disabilities, I feel that they do have some really good skills to offer. They've got more experience working in hospitals within Australia and a bit more experience with some of the disabilities. So it can often be really helpful to work alongside a physiotherapist.
Mm. We've been doing more and more of that here in Canberra, where we've got a few physio clinics that we've been into referring with more, and OT as well,
Right.
and really finding that the mix is good, and
Mm,
understanding that actually our scope of practice is quite different, and different enough that it is quite useful often to have both modalities working with a child, particularly one that has more complex needs. They do focus a lot on functional improvements and exercises and strengthening. And with our focus on manual therapy and looking at the whole, they're actually very complementary. And as we've gotten to know more physios that work near us, we've been able to build some great connections just with that shared understanding of what we both do really well and how we can help the same baby or the same child in quite complementary ways. So that's been very exciting actually to
mm.
understand that and to not see it as like two different approaches to the same thing, but actually two very useful complementary supports for each other.
Yes, absolutely. And there are lots of ways, I think, within pediatrics where it's really important to understand where osteopathy fits within healthcare in Australia. That obviously some babies do need to see a pediatrician because there may be a diagnosis that's needed with things like delayed developmental milestones. And really knowing what that is so that early intervention occurs is super important. But yes, I think there's lots of people that we probably connect in even more with children because I guess they can't communicate for themselves and advocate for themselves. We are often really wanting to ensure best care by working with GPs, with pediatricians, lactation consultants, dentists, OTs, physiotherapists. I get a lot of appointments made at this time of year for 4-year-old kinder finishers, making sure that they're school ready, looking at their motor development and their coordination. And I think that's another thing that osteopaths are really good at working on because we do look at that whole body connection rather than perhaps breaking it down into all of the different parts for a child who perhaps is a little bit slow with their milestones but doesn't actually have a diagnosis. So they need to improve their motor skills, but it's more a child that would be considered regular but needs to improve coordination and motor skills as opposed to some of the more severe cases.
Yes. And there's a vast number of kids out there that don't have a diagnosis and are on that range of normal, but there's still issues there. Like they're still uncoordinated. They can't kick a ball straight. Their balance isn't great. They're never going to fall into that category of needing a lot of further help, but there's so much that can still be improved in their musculoskeletal patterns and their biomechanics that may just set them off on such a different tangent through their life, and even how much musculoskeletal pain they end up with down the track.
And often
And
with osteopaths, I feel like with those kids, we often only need 1, 2, or 3 sessions to have a really big impact. And so it's really helpful for us to kind of say that to parents, that if we're treating a young person and they have a few treatments and nothing is changing, that's a really big key, that we're needing to link in with other health professionals even more. But sometimes I think with the NDIS, I find down here that things like speech therapy takes a long, long time to get into. And when we look at oral function, when we look at the function of the tongue, and when we look at the function of the body, quite often we'll have a couple of visits with them and help them to improve while they're on the waiting list for another practitioner. So we're not necessarily trying to do something that's out of our scope of practice, but we're also helping to look at those overall improvements so that the child is really ready when they meet that practitioner to make changes and to improve. And for those mild cases, to perhaps have a bit less intervention, and for the more severe cases, to sort of get them set up ready for success a little bit more quickly once they get to the speech therapist.
that's fantastic. So where to from here, Marnie? Obviously, you've got so many things bubbling away with research and teaching and running a practice with 9 practitioners, which is a significant number of people that you're looking after there. What's the future plans for you?
I guess really at the moment it's to kind of keep going. I love the idea of working at the universities. I've had wonderful opportunities, and I'm sure I'll have some ways that I can contribute. I'm really happy to do things like this. I feel like things that are recorded like this do allow people to watch them in their own time, have access to very cheap or free CPD, which is a great thing to do. I feel like I still have a real interest in research. And really would like to do more with that, whether I'm filling in questionnaires for people or whether it develops into something else. And I guess I just love to support osteopaths in education, both as undergraduates and in a postgraduate way, to help encourage them to stay interested in private practice and to diversify into the many areas of advanced practice that there are. And of course, my particular interest is in pediatrics.
Mm. So what's going to happen to all that work that you did to build the graduate certificate and all the resources that you've put so much time into over the years? Is anything ever going to happen with those again?
Yeah, well, it's really interesting. I think Victoria University has very recently opened up an existing program around strength and conditioning. So an area of advanced practice in terms of sports practice. There is now access to that course, and I think that's wonderful. I think that's the start of collaborating with physiotherapists, collaborating with universities to have programs there. And I'm hopeful that we'll be able to utilise those resources, and that in the future we will have a postgraduate paediatric program here. I'd love to be involved.
Would be pretty cool, wouldn't it? But till now, until then, we've got a whole pile of different options for people to sort of cobble together their own training. And there's always the OCC, I guess, as
Yeah,
well.
absolutely. Absolutely.
Um, Thank you so much for your time. I've really enjoyed talking to you. I feel like we could probably talk for another few hours. Maybe we can get you back in another time with a different set of questions about some other clinical presentations, because you've got such a huge amount of knowledge, and even the way you just present things, like it's very obvious that you've taught a lot, Marnie, because you're just a pleasure to listen to and to talk to.
Thank you. That's a lovely compliment, Anna. But I also want to say thank you for your efforts in terms of, it's really nice, I guess, for me, who has tried hard over the years to set things up, to be invited along and to support you, but perhaps not be the person driving it all. So a big thank you to Anna for helping to encourage early career osteopaths and to have some cheap and free ways to support each other. So really pleased to be here. Thanks, Anna.
Thanks, Marnie. All right. Thank you, everybody. We'll let Marnie go now and say thank you so much.